Dear viewers and readers, it's a privilege, it's an honor to welcome Dr. Tirone David to our conversation today. Dr. David is an internationally celebrated cardiac surgeon, a pioneer in cardiovascular procedures, and a dedicated innovator in healthcare. With his career spanning over 4 decades, he has performed more than 15,000 open heart surgeries, contributed to 16 groundbreaking surgical techniques, and authored over 450 scientific papers. His passion for advancing medicines remains undiminished as he continues to operate twice weekly at University Health Network's Peter Munk Cardiac Center in Toronto. He is a 2025 inductee into Canada's Walk of Fame and a recipient of Order of Canada, an embodiment of an life with an excellence and humility. Dr. David's story is one of lifelong learning, mentorship, and an unyielding curiosity that has pushed the boundaries of the medicine. So let us dive into the story of a legend and continues to inspire countless lives through his story. Dr. David, welcome to Magazica.
Thank you. Pleasure to be here.
And first of all, congratulations on being 2025 inductee into Canada's Walk of Fame.
Thank you. It's a nice honor. Yeah.
Thank you. So, Dr. David, your career spans, as we have mentioned in the intro, decades, and it's marked by numerous groundbreaking achievements. What was the moment or what experience first inspired your passion, your dedication for cardiac surgery?
Well, my father told me to become a doctor. I wasn't very keen in being a doctor. As I was growing up in Brazil, before teen years, I mean, one of my uncles was a pharmacist. And a pharmacist in the 40s and 50s is not like a pharmacist today. They are really what they call the compound doctors. They mix different elements, substance to make a medicine to work. I was fascinated by the chemical reactions. I know a 10-year-old and watching my uncle to work with different chemicals to make a substance or a final product that would cure pneumonia or stop somebody from having diarrhea or whatever the doctor had prescribed. Instead to prescribe a medication, they prescribe a compound of several substances. And Gabriel, my uncle, used to mix them up, and that fascinated me that you could do that. And then, of course, he taught me how to weight milligrams. You have some ultra-sensitive scales to take a milligram. So how is it possible to take 1 gram, divide in 1,000 times, and I can tell this is a milligram? All that technology and science of the time, of the 50s, fascinate me. So I want to become a chemist. I thought chemistry is the future. But my father had different ideas for me, and he said, no chemistry. This is we have a chemist in the family. Your uncle, you're going to be a doctor. And in Brazil, we start medical school when you are 17, 18. What do you know of 17, 18? It used to be the old European, the French system, where you start the medical school, in the first 2 years, you don't see a patient. You're not a doctor at all. All you learn is the fundamental basic sciences, like anatomy, physiology, pathology. You never see a patient, you see cadavers, not the cadavers, to learn to dissect. And so at age 17, I wasn't that convinced that chemistry was my thing. So I started medical school, and I was magic. I discovered a part of me that I didn't know I had. I was fascinated by the human body, how it worked, the physiology of why our hands have the shape they do. I mean, to learn that they must be the way they are because the optimal shape, in other words, is optimization to fulfill a function. Our body is the way it is out of necessity to do, to survive in the animal kingdom. And this fascinates me. And then, of course, you go to medical school, you start seeing patients, you learn about doctors and different specialties. And there came along a mentor called Giocondo Artigas. The guy was a surgeon, was an incredible technician. He worked in a Catholic hospital, which I used to moonlight, make some extra money, take call, and be able to pay for expenses and work like a nurse in the hospital, but also assisted in surgery. And watch this man comparing him to other surgeons was like night and day. He could do very complex abdominal operations without a drop of blood. Everybody else required pints and pints of blood in the patient's veins, and this man could do the same operation without transfusion. So I started asking him, how can you do this? He said, because I know anatomy, because I know where to cut, I know where to sew. I don't cut blood vessels, they don't bleed. And to be a 20-year-old and see that not all human beings are the same, you tend to gravitate to what is good. And he became my first mentor. And during the next 40 years that I worked with him, he kept telling me that you have to move away from Brazil if you want to learn something more than just what I taught you. You have to go to the source of where all these operations came from.
Okay.
So my father being American, he led me to come to the United States, and I came in as an intern in New York, and during my internship, I pretty much knew that I want to play with blood vessels, heart and arteries. So after my internship, I started looking for a training program where both vascular surgery of the arteries and veins, and heart surgery was well developed. And here I am. I never left Toronto. So from New York to Cleveland to Toronto, and I never left Toronto. All along the way, from my medical school, even to now, I think mentorship is very important. People that guide you in life, first you have to respect them. So you get to know someone, you admire them, respect them, and then if there is some reciprocity, mentee and mentor, they'll guide you to what you should do in life.
Yes. And we are very thankful to your mentor that he guided you, and to have your career, your growth, and your excellent contributions in Toronto. And being a Torontonian, we are grateful to you.
But even for that, to change what you're doing in life. So
Yeah.
you can come to work, do your job, go home and forget about the work. They taught me as well to think. They taught me to ask me why. If something doesn't work well, try to find a better answer. But before you find a better answer, you have to know everything that presently exists on the area. In other words, knowledge is the most important thing. You have
All
to know a
available
subject
information.
in depth
Yep.
before you can try to change the object.
Definitely. Definitely.
And surgery is no different. The terminology I like to use is one of a stepwise. You learn something, you learn well. You see, it's not perfect, so you try to aim for perfection by modifying it without harming it, which is a very fine line of between one and the other. If you're overly aggressive, overly inventive, without responsibility, it can harm the patient, and that's the human being. So I learned to be quite honest, largely by experience, by analyzing what I have done, look prospectively with the effect that had in the patient's body, and if it wasn't perfect, try to find out why it was not perfect, and change what was imperfect.
So first you have tried your best to grasp all the available information, and then first you mastered the process, then you went for make it a bit more perfect and better.
That's much better put than I did. Yes, you have to know the object as much as possible, knowledge, in other words, then try to modify it if you can.
Yeah. So really regarding to that, because our second question is kind of an offshoot for that. So you have performed over 15,000 open heart surgeries. That's a feat in itself. Before, like through this process, it's kind of the first conversation that we are having. It's fascinating. So it's almost like learning by doing, learning by after the doing from reflection, you mastered the whole existing knowledge bank, and then you try to remove the bits and pieces from weeds from here and there to make the whole thing much more better. So what drives your focus and preparation every time you get into the operation room? Like it can be very basic, but just to know the thought process.
First of all, it requires an incredible amount of attention and be focused on what you're doing. I believe in details. There is no unimportant part of caring for a patient. From the preoperative assessment and the necessary tests to diagnose the problem. And then once you offer the patient a therapy and you are the one to act, surgery is therapy, is a form of treatment.
Yeah.
And only exists because you don't have anything better. I mean, cut and sew is really archaic. You have something wrong in your body, you're going to take a piece or reshape it or take it out and add something else to replace it. This is very archaic. Only understand of science. I mean, why can't we understand why that part of the body became abnormal and try to reverse biochemically and structurally the way it was?
Yes.
That's the future. It's not surgery.
No.
Surgery is really, it sounds gross, but it's butchery, really. Of course, if you have a broken bone, you're going to have to put the bone aligned in certain shape to allow nature to heal. But if you have a tumor somewhere in the body, why to cut the tumor out? Why can't you find a way to reverse the function of those cells that went berserk to form a tumor? That's the future. That's where medicine should go, not where I am. Meantime, however, we have to keep the people alive and thinking and doing things.
Yes.
So the best science is what we do now. But this, I'm sure, if this conversation is listened 1,000 years from now, they're going to say, look at this archaic dinosaur, what he's saying. You're going to cut a human being to be able to fix a malfunctioning part of the body. I mean, you don't cut someone to cause more harm by cutting than the fixing. Anyhow, in this context, I'm realistic enough to know that what I'm doing is the state of the art of 2025,
Yeah.
you're not to be next 1,000 years or how many more years. I don't know, it's going to take 1,000 years or maybe 50 years only. And surgery is going to become totally obsolete. All that to tell you that surgery is therapy, is a form of treatment
Yeah.
for something that's not working well. Taking this into account, then you have to understand whatever existed prior to where you started.
Mm-hmm.
And knowing that, you'll be able to execute an operative procedure to modify or to improve a malfunctioning part of the body. In my case, heart.
Mm.
Well, in all my innovations over the past 45 years were related to make the function better than was before by cutting, stitching, modifying, or adding tissues to whatever became abnormal. I'm very critical myself, critical my partners, critical everyone. That's part of personality. But also, I'm very analytical and open mind enough to know what I do is not perfect. It's good, sometimes excellent, but it falls short of being perfect. And perfection perhaps not attainable. But if I don't look for perfection, how am I going to make it better?
Yeah.
I can only make it better if I try to be perfect. So it is this intense desire to become a perfect surgeon that innovations came to be.
Yeah.
And some very simple, is my very first innovation. I was a student. A new material came to be, polypropylene. And the knot, however, is very bulky. And surgeons, I used to be a general surgeon before I became a heart surgeon, to close the belly. The knot was so bulky that in skinny people, the knot would protrude to the skin. So I said, bury the knot. My very first paper published is burying surgical knots. If you bury them deep into the tissues, when the patient puts his hand on his scar, he's going to feel no stitch beneath.
Yes.
But these are simple technical innovations that make a major difference for the patient. Why not?
Yeah. So very fascinating because the two ideas that I got it from, like personally, I liked very much is your analytical and critical. And I think the way the conversation is going, that is a big contributor to your detail-oriented process making. Those are the two qualities contributed. I really had a paradigm shift in my head that surgery is part of healing, and through that healing, you are enhancing the functionality of the patient before the patient came into the operating table.
Oh, absolutely. Yes.
That's how I summarized
But
it.
that's correct.
Yeah.
Very well done.
Yeah, fantastic, fantastic. Analytical and critical, and basically critical to myself. Myself means my work process, so that I can enhance the functionality of my process. That's a universal principle. Anyone can take it up and apply it in their own individual job, and that's fascinating. And learning from a person like you, experienced person like you. So you are still innovating and operating twice a week. And do you maintain, how do you maintain, like, I'm
Well,
talking about your
twice a week
energy,
is
your
what I
focus. Sorry.
twice a week is the official one. There's no part-time heart surgery. It's
Oh,
impossible. I years ago, 4 or
oh,
5 years ago, I decided 2 days a week should be enough. I'm proficient. I don't have to learn anything anymore. All I have to do
but
is
you have to do
now.
more?
But last week, for instance, I operate 5 days a week.
Oh,
Every single day
wow.
I was in the operating room. As a matter of fact, Friday, I started at 9 o'clock. I didn't leave the operating room until 2 o'clock. I decided there was an emergency coming in, very, very serious problem. The patient had multiple previous heart operations, and
Oh,
everything was falling apart. And
oh
I
God.
decided to take the patient on. It started like 3:30, 4 o'clock in the afternoon, didn't finish until 2 o'clock in the morning. Given the complexity of the situation, just about every part of the heart had to be reconstructed or re-reconstructed
Oh,
because she had had multiple operations. So
okay.
the 2 days a week frequently ended up being 3, 4, or 5 days.
Yes.
It was a nightmare.
Yeah, so that makes that revelation makes my question more pressing and more engaging. How do you maintain your, first of all, your energy, second of all, your focus, and that, because we know that cardiac surgery is a very demanding procedure. So how do you maintain your energy and your focus?
I think is, to be quite honest, is largely mental.
Yeah.
Let me give an example. more than 10 years ago, I complained to my doctor that I was getting up too often at night to pee. This sounds too personal, but it's very pertinent to what I'm going to say.
Yes, please.
Uh, I said, I have to get up 2 or 3 times to pee. And then, of course, if you get up, you go to bed at midnight, you get up at 3 o'clock, you fall asleep again. But then you get up again at 5, your night is finished, and you're tired next day. And he said, there's nothing to do with your prostate. Forget about your prostate. It's on your brain. I said, what do you mean, my brain?
Oh,
He said, I know you well enough to watch you in the operating room. You do a 12-hour operation without
oh,
ever leaving the operating room to pee. Why is that?
oh,
Mental. The brain produces a hormone called the antidiuretic hormone. So, for instance, Friday, I start at 3:45, I finish at 2 in the afternoon, 2 in the morning. If you
oh,
add, these are precise 10 hours in the operating
10
room.
hours, yeah.
I didn't have to leave to empty my bladder because there was nothing in my bladder. My brain produced a hormone that makes me stop urinating, stop producing urine. And this scientific sound of me telling you, it's called the antidiuretic hormone. You're
Oh,
so apprehensive, so preoccupied. You're looking at the problem that you're facing so intensively that nothing else matters.
laser-like focus.
In other words, my hormones, my whole body, my whole thing works in synchrony to execute a job that
Yes,
I intended. Of course,
absolutely.
the moment I finished the operation, I had to go to the washroom because now you're relaxed, the patient's alive and
Yeah.
well. But my bladder said, hey, I want to be empty now.
Yeah, now it's the time, please.
But that's an example. It's not only antidiuretic hormone that the brain produce much more than that. Produce a bunch of endomorphins or things that if you have a sore knee or a sore back, they don't hurt in the operating room
Yeah.
because the problem you're facing is so overwhelming that your brain has the ability to block everything else.
Yeah. Endorphin sometimes is called, I think, indigenous morphine.
Absolutely, yeah, it is. Yeah.
So, yeah. So,
So, and that's so you go in the operating room, you are transformed. At least I am transformed. My only focus is the patient, the operation. It is said in medicine, as you know, that we doctors are not supposed to take care of our close to us, close friends or family or children. I have operating several close friends,
oh,
and they know how I am. And to be quite honest, the moment I come in the operating room and they're all draped, they're not my friends anymore. They're a challenge that I have to face and a
fantastic.
problem that I have to solve. And I could care less who's behind the surgical drapes. They're all the same. Could be my wife, you, my neighbor, a stranger to me. I treat them all the same. It's the commitment that you have to solve a health problem. And the patient contracts you to do that job. And that's what you do.
Yeah. One of my, in university, one of my philosophy professors said that you have to take out emotion from your thinking equation to make an excellent decision.
Yes, yeah. Unfortunately, that's easier said than done, particularly
Definitely.
preoperatively. I see a very sick patient, and based on all my experience, I know that they should not have an operation, because if I take them to the operating room, I'm going to end up killing that poor patient. But the desire to help a suffering soul is so
Yes.
intense that sometimes you let the emotion take over the reason. And I have to confess to you, I have made this mistake sometimes. I'm very dedicated to my own patients. If my patients come back to me years later, I have a lady came in, when she was 18 and then 28, but she wants to have some children. I couldn't do a more definitive operation. And she came back again, 45 years later. And everybody said, don't touch her. She's going to die if you touch her. But she was miserable. She couldn't live anymore the way she was living. And I took her on. I didn't kill her. But a month later, she's no better than she was prior to surgery. So the operation was futile and largely based on emotional decision, which is wrong. I should not have done that, only because I saw her suffering was my innate desire to help her again. But I failed. And she didn't die, but went through the ordeal and operation for no benefit.
That's a great thing that you have put in. I really like the phrase that desire to support a suffering soul.
But I don't
It's
know.
a strong commitment.
Yeah. I like the most impressive hospital I've ever seen in an advertisement when you walk in a hospital was in Puglia, Padre Pio Hospital. And I have a slide on the main entrance door. Is in Italian, of course, but the translation is, this house was meant to alleviate human suffering.
Oh, wow.
I mean, and that's what hospital
That's
doctors are supposed to do, to alleviate suffering.
alleviate sufferings. And you played your part like in a fascinating way in this 45 years. You have pioneered 16 surgical procedures. Could you
Well,
share one
it's
story?
a number, but truly original, like never anybody ever thought before, maybe 9 or 10 that
Oh.
they were considered really like a discovering something new. The other ones were modification of pre-existing knowledge that made it better, made closer to perfect. Not
And
perfect yet, but
so
closer to.
for those 9 and 10, we will go with obviously your statement. For those 9 or 10, that is kind of discovery that you had. Can you share one story or behind the passion or behind the scene of the thought process of the discovery, or what motivated you for the discovery? Can you share one story briefly?
That's a very simple one. It was done back in 1985. By 1985, we all knew already if you had a malfunctioning valve in the heart, replacement was the treatment. However, replacement is not perfect. It make you feel better, but it's short-lived. It has a number of associated problems. So we discovered back then that if you can repair your own, is better than a replacement. However, a bad repair is worse than a replacement. So it becomes a very gray between the black and the white, replacement and repair. There is all shades of gray. And it is our job to move more and more towards the one side or the other.
Okay.
To know, to be able to discern this one here is better to replace because if you repair, it's going to be a lousy repair. This one is better to replace. Back in 1985, most surgeons who are dedicated to heart valve diseases could repair approximately half of the mitral valve, a very common valve in North America, in Eastern Europe, Eastern Canada, Western world in North America, United States and Canada, is the most common cause of leaking valve. But the techniques existing back then limited the number that could be repaired. So I was traveling once, and I saw a professor, a famous professor in New York City, experimenting in a laboratory Gore-Tex to replace parts of tendons in the body and to replace other cords that we have in our body, including
Tendons means cardiac muscle?
yes.
Okay.
Well, not cardiac muscle. It's a cord. It's a fibrotic thing that attached.
Like a string.
Yeah, a string like attached two parts together.
Okay, please.
So and he was trying to replace parts of the heart with that.
Okay.
Parts of the valve. So I asked him if he mind if I try in humans. He said, "Be my guest." So I came home. I took half a dozen pigs, replacing the pigs first to see how I'll do it. Went to the operating room and replaced one. Replaced the one that otherwise I would have replaced the valve with an artificial valve. I didn't do a thing, wait for 2 or 3 months, saw the patient, did an echocardiogram, was perfect. Wait for 3 more months, another echocardiogram, was perfect. I said, it's time to do a second. And did about 5 or 6 more. All very cautiously, all wait and see, do and watch the patient, see what happens. Well, by 1990, 5 years later, I'd done over 100. None of them had failed. They're all perfect yet. So then, of course, became standard. Then we published and we told the whole scientific community, that's what I'm doing to replace. It's a very simple thing to replace a cord that anchor a valve in the heart. However, it saves at least half the patients that would otherwise have a replacement. It made a major difference. And if you try alternative techniques, it works too, but not as well. They fail after a while. But this one fails as well if you don't do right. So simple modification of an operative approach, but has made a major difference on a patient's outcomes. Not only for one valve, I work in every valve in the heart. Another one is called the aortic valve. And until 1985, 86, every time a young patient, and these are almost invariably young people, they are teenagers or 20 or 30-year-old, they come in to the doctor, not because the valve is bad. They come in because there's an aneurysm, there's a bulge in the first part of the aorta that's attached to the heart and carries blood to the entire body. But the valve inside is perfect. Well, this English doctor called Hugh Bento discovered this revolutionary operation. You cut everything, put a conduit, a pipe of Dacron, put a valve inside the Dacron, and reimplanted the arteries that feed the heart muscle. It's called the Bento procedure. It was the classic solution for the problem. And these patients lived longer, but they have an artificial valve in the heart. Well, I learned to do the operation, and I did many of them. But one day I was open the heart, and this valve was pristine, beautiful, normal, like a normal 16-year-old has. But the tissues around were all falling apart. So it occurred to me, why am I replacing every part when only the supporting tissues are defective?
Oh,
So as an artisan, I replaced the supporting tissues. And I
yeah,
didn't do anything else, didn't tell anyone, told the parents only. Because the parents did not want the girl to have an artificial heart valve. Being 16,
yeah,
the parents wished that to grow, to have, get married, they have family.
yeah.
So I wait for a month, 2, 3, she's perfect.
Fantastic.
I offered to a second child, to a third child, and from 1985 to 1992, I had done several dozen. This operation was named after me because this one was entirely revolutionary. I mean, totally different than anything else
Yeah,
done before.
sounds like exactly
It's
that.
called the
Revolutionary.
David operation.
Yeah.
And there are several variations of it, but they're all primarily to save the patient's valve when the surrounding tissues are abnormal. That has made a major difference in people's lifespan.
Sounds like that. Sounds like that. Like hearing those stories, or like the way it unfolded and everything, and how it impacted human life positively and proactively, it's very inspiring. Many of our readers, Dr. David, look for inspiration to make healthier lifestyle choices. From your vast experience reserve, what are the key actions, according to you, individuals can take to protect the health of their heart?
I wish I had an answer. What is known is, is all motherhood statements. Do not smoke.
Mm,
Be physically active. Eat well. Don't eat garbage.
mm.
Unfortunately, even if you do all this, there is one component in heart disease that is not modifiable: your parents. In other words, your genetic makeup.
Oh, yeah.
But even that now, we are learning to modify.
Fascinating.
I'm telling too many personal stories, but I'm going to tell this one as well. I have a family history of high cholesterol. My mother had, my father never had, but my mother and 2 or 3 of her children had high cholesterol. So at 32, I was a fully trained heart surgeon, but I knew I had high cholesterol. I met this Hungarian cardiologist, wonderful, wonderful woman, helped me a lot when I was a young surgeon. And she traveled to Europe frequently, but she was trained in Europe, in Switzerland, and she, during the war, and then came to Canada. But all her friends and some relatives who are still in Europe should go there often. So her knowledge of European medicine was quite high. She told me that they had been using in England and in certain parts of Europe a medication to bring the cholesterol down by blocking the production in the liver. Why don't you take it, she said, if you're worried about your cholesterol? And I said, well, I'm not taking medication. I don't like medication. She said, well, it might make a difference in your life. And so I started taking very early on a group of drugs called statins. They block the production of cholesterol in your heart. And I think that's been one of the major contributions to reduce the risk of heart attack and heart diseases. And in addition to that, statins have what they call the pleiotropic effects. They have other effects that are not intended, but they happen. Some bad, some good, mostly good though. I never worried about my heart until I turned 70, so I decided to have the first cardiac test when I was 70. And the guys who did my test called me and said, there's something wrong in your chart. They say you're 70-year-old. I said, I am. They said, no, you're not. I mean, I'm not. I'm telling you, I'm a 7-year-old because my heart was not one of a 7-year-old. The arteries was one of a 35-year-old.
Fantastic.
And I attribute that only to the attempt to change the genetic makeup of my cholesterol. And the cholesterol is one of them. There are many others that we're discovering more and more.
Wow.
But anyhow, in a nutshell, I think is the known risk factors is diet, don't eat too much fat, limit the carbohydrate, stay physically active. It's very important to stay physically active. Don't look for the parking spot closest to the mall. Park it further away and walk. And walk perhaps the single most important physical activity. And that's what we have modern society don't do anymore. We sit in front of a computer all day or don't like to walk. We should walk more. Don't gain weight. And take a look at the cholesterol profile and lipids. If they're abnormal, that our chemicals can be modified.
Well, fantastic insights. And what we are almost at the end of the conversation. So how do you see okay, before that, it's the second last question. Apart from having all the accolades and everything, countless accolades, I would say, your humility is remarkable throughout this conversation. And I think in your personal life, it is also that the website that your description, your introduction was given, there also this word was mentioned, humility. What role do you think humility and curiosity play in driving successful and innovativeness in your field?
I think scientific arrogance is the worst thing can happen to a scientist, to a student.
Okay.
The moment you think you know everything, that's when you're going to begin to fail. I'm humble. My humility comes from knowledge that I don't know everything.
Fantastic.
In other words, I told you a story for the past 15, 20 minutes, but I started by saying that's current knowledge. I know damn well that somebody's going to laugh at what I said next decade or two because it's going to become archaic. It's going to become totally irrelevant. I know that, and this makes me humble. That I think I'm very good now, but I'm good only for this period of time. And curiosity, I think, is the ingredient that make things better. You kept looking for better answers. You have to be inquisitive. If you're not inquisitive in what you do, how can you change your field? How can you change your culture? It doesn't matter what you do. A musician, if you're an architect, if you're the garbage collector, if you're a floor cleaner, keep thinking in better ways to do it. And suddenly you're going to do better.
Yeah. Our very last question, two things. Any one or two of your dream that you want to fulfill in the upcoming times, and advice to young professionals, young doctors, or young cardiac surgeons and cardiac specialists.
Well,
Just two things.
I think it's very important to like what you do in life. If you get up in the morning and find this a drag, you say, oh my gosh, I don't want to go there. I don't want to do this. Find something else. Now, if you don't have anything that interests you, then I don't have any advice for you. But I think to seek, to find something that turns you on, that make you want to be alive, want to continue to be alive longer, to do more of the same. That's, I think, is one of the secrets to be happy and to do things well.
And any dream that you want to fulfill, for your mission, your vision for future cardiac health or cardiac treatment, anything?
Well, at my age, To be quite honest, my main concern is to remain physically and mentally well to continue doing what I love so much. So, but I am intelligent enough and realistic enough to know that life is finite. And eventually I'm going to have to bow out and say, well, thank you very much. That's what I have done. Now I'm going to learn to play golf and go fishing.
And what a career you have. It's a fascinating, it's a contributory, it's philanthropic, whatever the term I say, it's limited. Thank you, Dr. David. Thank you for giving us such a wonderful time and such wonderful insights for our readers and viewers. Thank you very much.
Pleasure. Have a good day.
Yeah.
Thank you.